All right, Big Bang. Today is Thursday, September 19th. Welcome to the Dog Walk presented by Barstool Sports. We got a big crew. We got a full desk here in studio. If you're watching on YouTube, I swear this isn't a Halloween episode as you see skulls and brains on the table. But instead, I am joined by Chief, of course. I'm also joined by Pat Tomasulo from WGN, stand-up comedian. And I am joined by Dr. Babak Jahromi, a neurosurgeon from Northwestern Medicine. And we're here to talk about Pat's charity and just talk about neurosurgery in general. It's a very important job. Thank you for joining us.
Absolute pleasure to be here.
Yeah, this is fantastic. I'd come here every week if I could just hang out here. That'd be awesome.
Live down in the golf simulator.
This is unbelievable. You didn't let me do anything. I wanted to fire up the jugs machine.
You got to go to bed.
I think we
soon.
rented those. Yeah.
It's unbelievable.
It's 6:30. Pat's got to be on the air in 5 hours?
I'll stay here all night. I don't care. I don't got to leave.
You can't do it. But anyway, so how this came to be was, Pat, you have your charity, and you can get into everything. Yeah. Your wife has, I'm going to pronounce this correctly.
Do it, baby.
Trigeminal neuralgia.
Yes, sir.
I did it.
Yeah.
And this is something you've talked about openly on the air for how many years now?
This is our 10th year. This is our 10th anniversary.
Okay. Yeah. So big fundraiser. This
is it, man. So we do the Laugh Your Face Off fundraiser. You want me to get into TN and what it is and all that?
Absolutely.
And Dr. Jahromi can too. He's Northwest. How long have we been partners on this? About 7 years. Northwestern has been the presenting sponsor. So my wife has trigeminal neuralgia, which is a disease or a disorder of a neuropathic facial pain disorder of the largest nerve in your face. You have a trigeminal nerve on each side of your face. And there could be a number of reasons why it gets damaged or you have this pain. Sometimes there's no reason at all. But what it is it causes excruciating, debilitating, electric shock-like, lightning bolt stabbing, like your face is attached to a car battery pain that medically is often referred to as one of the worst pains known to mankind.
It used to be called the suicide disease.
Right. And it still is, in some circles, not medically.
They got away from that for...
Well, I mean, I don't know that
stigma.
medically that was ever... I think it was just kind of the moniker it earned because some people, the pain is so horrendous. We've had patients that we've lost over the years because of it. And there are some treatments for it. There are medications. There are some surgical interventions that Dr. Jahromi will talk about that work for some people. But for an overwhelming number of people, they've exhausted all of these options. So that's Amy. That's my wife. So she's had TN since 2001, atypical version of it. So she has pain all the time. And then she gets these horrific attacks multiple times throughout the day. So we started this in 2015. We raised money for the Facial Pain Research Foundation, which is the only group in the world that's dedicated solely to funding TN research. I now help run that foundation, and Laugh Your Face Off is our biggest fundraiser. We've raised about $3.75 million in 9 years.
Wow! Congratulations!
Yeah.
That's something else.
Thank you.
Yeah.
No, and it's something where too you sent it to me, and I was reading all about it, obviously doing research for this interview, and it's horrifying.
Yeah.
It sucks, and obviously it's tremendously affected your wife and you.
Yeah, I mean, some of the triggers are, sometimes the pain comes for no reason whatsoever. You just get attacks. You're just walking and you get an attack. But for Amy, one of her biggest triggers is touch. I've never touched the left side of her face in 23 years, right? So a breeze, she can't go outside if it's breezy. I would say this summer, we've probably walked the dog together 4 times at best, right? Think of if you're in a restaurant, an air conditioning vent is coming down, you're feeling that, she can't deal with that. Brushing your teeth, laughing, talking, smiling, right? That's the irony of us doing Laugh Your Face Off, right? Because it kills her, but she is such a massive...
living with you.
right. Yeah. But she is such a massive comedy fan. Mm-hmm. She loves it. This is what she wanted to do.
Mm-hmm. Hey, before we really kick things off here, though, I do want to talk about our friends at ChevyDrivesChicago.com. Fall is kicking in and back to our favorite sports season. Whether you're going on a game road trip or prepping for a big tailgate, your local Chevy dealers have you covered for the perfect SUV and trucks for all the space you need. The Chevy Silverado comes in a variety of different custom styles to fit your needs, and you can always count on your Chevy to have the best technology no matter what you choose. We got a big road trip this weekend.
Yep.
Driving up to Indy to see the Bears-Colts game. I hope we get a Chevy, whether it be a Suburban or a Silverado.
Suburban would be perfect, yeah.
It'd be perfect. It's always the most comfortable it's roulette when you get the
I know.
rental car
Yep.
situation. So I hope we get a Chevy. We always do.
That and a Bears win are the only things that would make that weekend better.
I would.
Yeah.
I would. So the official truck partner of the Chicago Bears is Chevy. So head to ChevyDrivesChicago.com to find your truck today. And while you're there, obviously they got a great assortment of SUVs.
Should we just take the
and
Blazer?
sedans.
Should we just take the Blazer?
Take the Blazer?
Yeah.
Yeah, we could do that.
Let's take the Blazer.
All right.
ChevyDrivesChicago.com. Go check it out. One thing I found interesting, you said there are some reasons that it will get damaged. What are some reasons that it would get damaged?
So there are a number of causes for trigeminal neuralgia that we can pinpoint on imaging. One potential cause is a blood vessel pushing on the nerve, and that lends itself to a particular surgical treatment where you can space out the blood vessel that pushes on the nerve. So that procedure is called the microvascular decompression. A very good track record, a reasonably high cure rate. However, there's a lot of patients who don't have a blood vessel pushing on that nerve, so they're not a candidate for that procedure. And even in that procedure, 1 out of 10 to 1 out of 5 patients after 10 years may have pain recurrence. So it's not a fully well understood disease process. We know some of the causes and some of the treatments, but as Pat said, there's a lot of patients in whom these treatments are either not applicable or they haven't succeeded. And so the biggest thing in front of us is how can we better understand this disease and find better treatments. And here's the challenge. Our society understands chronic pain. Patients have leg pain, back pain, neck pain. But facial pain is different, right? So you can kind of sit or adjust your posture and figure out how to deal with the neck pain or back pain. But imagine just talking causes a horrific stab of pain in your face. Imagine eating food feels like somebody's stabbing you with 220 electric volts. Imagine just a wind, a shower, shaving your face, chewing, anything, or out of the random. So you can't hide your face. You can't cover it up. You can't not talk, eat, chew, smile. And so it is one of the most disabling, debilitating forms of chronic pain you can have. It really secludes you from society. It affects your life.
The human experience is what it sounds like.
Completely.
Correct.
Yeah,
Completely.
yeah. Can you show us where that nerve is on your model?
There we go.
Absolutely.
Come on.
I'm glad you brought this
Yeah,
because you
this
showed
is
us a
very
little bit
helpful.
beforehand, and
Yeah.
it was.
A model is much easier to understand.
Yeah.
So imagine this is a model of the brain. This sits inside the skull. So we won't take the top off for now, but this would sit inside as such. And at the base of the brain is the brain stem. So this structure, this is the main conduit that connects everything else in the body to the brain itself. And out of these come nerves, think of them as cables that connect different parts of the body, or in this case, the face, to the brain. These two spots that you can see, these are the biggest nerves coming out of the brain stem. These are the trigeminal nerves. And each of them innervates the sensation on one side of the face. So theoretically, if there's a blood vessel here, to get to it, you've got to drill a small hole about the size of a quarter in the side of the skull, and then under a microscope, very carefully work your way all the way from the outside down to almost the very center of the brain, of the brainstem, find that blood vessel and tease it away. So that's where the nerve is. That's how you reach it. It requires expertise and a lot of a good team around you to be able to support you, to do it well, and so on and so on. But again, not everyone is a candidate necessarily for this particular procedure. There are other ways to get to the nerve. So another way to get the nerve is, remember, it has to come out of the skull into the face. So that means it's got to come through a hole in the skull. And under X-ray, you can actually find where that hole is. It's going to be hard for your viewers to see it, but it's right there. So another potential procedure, and
I'm sorry, were you pointing near the cheekbone there? Is that
correct.
Okay.
So while a patient is asleep, you can actually gently poke a needle through the lining of the cheek, not through the cheek, and go back to the base of the skull. And I'll demonstrate that for you. Pat loves when I do models.
Oh, yeah. I love your props.
But again, the point is that getting to that nerve is not straightforward. So if you look at the base of the skull, and I'll show your viewers, that nerve, remember the brain would sit here.
Yeah.
That nerve, I should say, sits right over here, right at the center. However, there's a small hole that you can get through under X-ray control. So with a needle, you can poke through and get in there. And then through that needle, this is where it kind of gets fun. for the patients who are able to treat this, to tolerate this treatment, you can put a small balloon, and that balloon comes out right there.
I got a lot of props.
And then you can actually inflate the balloon, and I'll see if that shows up on the video. All right, do you guys see that?
I see it. Yeah.
Right.
I don't know if it'll show up on camera. What do you see, Lance? It's a very small little balloon, and it's almost clear once it's inflated.
Oh, you can see it a little bit, yeah.
Okay.
There we go. So fundamentally, the goal is either there's a blood vessel on the nerve and we want to get that pressure off from the nerve. The theory is that that wears off the insulation of the nerve. And so think of the nerve as an electric cable. If you wear off the insulation, it's going to have all these sparks and hyperreactivity, and that we believe is what causes the jolts of pain to the face. But there's some patients who don't have that, and the etiology of the disease is probably somewhere else, perhaps in the nerve's junction box, where it splits into 3 divisions to supply the face. So the other way is to try to selectively injure the nerve, and there's a number of ways of doing it. You can put one of these probes in and inflate a balloon and deliberately do a mild crush injury of the nerve to numb it up. You can use a radiofrequency probe, or you can actually do stereotactic radiosurgery non-invasively in some way, create a lesion on the nerve to kind of dull it down, to stop transmitting the pain. Again, these are very practical. They work in a significant number of patients, but these kind of treatments, unfortunately, aren't permanent. The pain can come back, and a lot of patients may not necessarily be a candidate for it, or it may not work. So at the end of the day, you have a disease process that's debilitating, not well understood. There's a number of good treatments, but there's a lot of patients in whom the treatments are not applicable or haven't worked, and that's where Pat and his fundraiser comes in.
Okay.
I also want to say that the very first time I met this man, he came into WGN holding nothing but the skull, looking like he was about to perform Hamlet. And I thought to myself, who is this lunatic carrying a skull?
Who art thou?
in here?
That
But
is
also,
the true
too,
story.
Yeah.
you know, the other thing is too that I think you can attest to is that a lot of these procedures too, you know, depending on the severity of the case and how many options they've already exhausted, there is always the risk that there are side effects to some of these
Very
too,
much so.
right?
So
So
that-
it becomes
yeah.
the lesser of two evils. It's the devil you know versus the devil you don't. There are some instances where some of these procedures could theoretically, right,
Correct.
intensify the pain.
Because remember, we're in some of these procedures trying to deliberately injure the nerve.
Right.
There's only so many times you can do that before the side effects mount up. And one of the concerns, if you do repeated procedures, you can get a permanent numbness of the face, the sort of burning, uncomfortable numbness.
Okay, so it would just be because I was going to ask if you have like a semi-facial paralysis.
It doesn't cause paralysis. So it's
Okay.
important to remind our audience, the trigeminal nerve is not the one that supplies motor function to
Okay.
the muscles of facial expression.
Okay.
So this should not happen.
Okay.
But there's nothing more uncomfortable than this burning, constant background, numbing, itching, dysesthetic pain. And so you cannot repeat the ablative procedures where we injure the nerve multiple times. They buy some time, and in between, medication becomes the mainstay. Again, there are some good medications that work well, but they also have multiple side effects. And so, again, what we have to find are better treatments, better options, and a better understanding of this disease.
How difficult is it to diagnose this?
It shouldn't be if you
Right.
are educated on it. But man, I can't tell you how many patients, and I'm sure you've seen hundreds. I mean, we have one patient on our committee that went 19 years without a diagnosis.
Oh my God.
19 years. We hear this all the time because their first stop is always a dentist. Because they're like, oh, my
Yeah.
tooth hurts. And then the dentist, yanks a tooth or does a root canal or does something and then just keeps, I don't know what to do for you. So they send them off to a pain management doctor who's shooting them up with God knows what before they finally get a diagnosis. Amy was, I think I've told you this, Amy, we were living in Rhinelander where you guys did the camp. She woke up one day with the horrific pain. She went to a walk-in clinic in Rhinelander, Wisconsin, a town of 7,000 people, and some young doctor diagnosed her on day one.
Wow.
That's
Yeah.
incredible.
He just knew it. He knew what it was.
shit.
Now, that didn't stop her from getting butchered by a couple other pain management guys, but it saved her probably years of
Figuring
bullshit.
it out.
Yeah.
Yeah, because the person I know that has it, they like got teeth pulled and they
Right.
did a whole bunch of things. And
How many patients what's the average span of time people have been suffering before they finally get to you?
In my practice, typically it's been 3 to 10 years minimum.
You imagine?
Wow.
And, you mentioned the dental detour. That's very common. But in defense of all of the practitioners out there, trigeminal neuralgia is a very rare disease. True trigeminal neuralgia has a very low prevalence. So there's not a lot of people who have that disease, versus the majority of us, if we have this sharp stabbing pain in our face, we're going to think it's a dental abscess.
Right.
Or we're going to think we have a sinusitis, or we have TMJ pain, right? Facial pain affects at least a quarter of adult North Americans at one point in their life. Trigeminal neuralgia is going to be a very small fraction of that. So it does require a select center and a select group of people who can tease out the minutia, because the treatments for TN are extremely different than any other disease.
And there's no physical markers or anything that you would see. Have you ever had?
The story is the key.
Yeah.
If you listen and you ask the patient about their pain pattern, there's no blood test. The MRI may or may not show anything. There is a higher incidence in patients with multiple sclerosis, but most MRIs can be normal. There's nothing more important than just sitting down and listening to the patient. That's how you diagnose it.
Have you met any patients who were referred to like a psychologist?
Oh, I'm sure. Yeah. I
Right?
mean, Amy was told that.
Yeah, like, okay.
Yeah, she was told that by some quack who
Like that.
some pain management doctor, and he was like, "Yeah, I think you should see a psychiatrist now." I mean, she still deals with nonsense like this. Like, she was in an Uber not too long ago. I mean, this isn't a doctor, but this is what they deal with, right? These patients, because it's an invisible disease, like you said. There's no physical markers, right? So you could look at somebody and think they look fine, and they're literally dying on the inside. And she told me she was in an Uber, and the guy had the windows down. She can't have that, and she said, she never really does this. She normally just asks. She goes, "Hey, listen." She goes, "I have a really bad facial pain disorder. The wind hurts my face." She said, "Can you roll up the windows?" And this guy said to her, "You know what hurts my face? When people lie to it."
Oh,
You believe that?
Jesus. Wow.
Right? And it rolls off her back. She doesn't.
Yeah.
She's tough,
Yeah,
man.
still,
She doesn't care. But this is like the kind of stuff, right? Like, yeah, of course, tons of patients have been referred to psychiatrists for stuff like this.
Mention the key part. There's no visible mark,
Right.
And it's also in your face. You cannot hide your face.
Right.
It's part of who you are. So a challenging disease for the patients to manage and for physicians to diagnose and treat.
And Pat, if it's not too personal, but
Yeah.
I assume hers is coming from the nerve box, like you said.
We have no idea.
No.
No, we have no idea. Hers is idiopathic. We've not. There's no. Her MRIs are clean. There's no. She has a great deal of autoimmune issues too, and I have no obvious scientific data to back this up, but there's a big correlation between people I know who have TN and who have autoimmune issues too, which would not be that far off, right? Because as Dr. Jahromi said, there's demyelination of the nerves that happens. Sometimes it happens from a blood vessel rubbing up against it, or sometimes people just have a condition where their nerves suffer from demyelination, like MS is demyelination of nerves. That's why a lot of people who have MS have trigeminal neuralgia. So I think
All right. So I didn't really know what that word is. What's
demyelination?
Yeah.
So that's the myelin is the protective coating of the nerve that he was talking about. So think of that that electric wire where there's that rubber coating on the outside. That's the myelin.
Okay.
So when it rubs away and disintegrates, that's demyelination,
exposed.
and it
Yeah.
exposes the
Okay.
nerve. So our research at the foundation, we just completed our genetic study, and it suggests that young women who have TN between a certain age range, when they're diagnosed, it's often demyelination is the cause. So, but we don't know why, and that's what we're trying to figure out.
The incidence of trigeminal neuralgia is much higher. So in patients with multiple sclerosis, in the average population, the prevalence is maybe 15 per 100,000. But in patients with multiple sclerosis, it's 1 to 2 per 100. So if a patient has multiple sclerosis, their odds of having TN are multiple fold higher. And you can actually sometimes see on an MRI where there is what we call a multiple sclerosis plaque, an area where the white matter, the cabling of the nerves or inside the brainstem has been worn off. So the electrical analogy, I think, holds. That's where you probably get this aberrant transmission of signals that the brain interprets as stabbing pain. And think about it: your face is perfectly normal; nothing bad is happening while you're under this excruciating pain. So somewhere along the conduction pathway, from the face to what we call the ganglion, the nervous junction box, to the nerve itself, to the brainstem, to the brain processing it, that conduction pathway and its interpretation has gone awry. And that's what makes it a tough disease, because it could be at any of those points.
Now, you do a lot of surgeries, right? You do carotids, you do aneurysms. How much does TN take up of your...
Over the years, it's become a larger part of my practice. One is I have a particular interest in it. It allows me to use my skills that particularly devoted to operating in through delicate blood vessels in deep corners of the brain to actually treat a different disorder than stroke or brain aneurysms. And it also lends itself to minimally invasive treatments, such as putting a needle through the cheek under just X-ray control. So it's very appealing from a technical perspective to a vascular neurosurgeon. However, the biggest reason I really enjoy helping these patients is much of what I do is helping patients who either have arrived with a severe or catastrophic or at least serious ruptured brain aneurysm. And at that point, it's somewhat trying to salvage, buy time, and hopefully fix the catastrophe that has happened and get patients to get to a point where they can heal. Or these are patients in whom they come with a unruptured brain aneurysm. A brain aneurysm is a small little blister that is a weak spot on a blood vessel that could potentially rupture in the future. And so in my professional vascular neurosurgeon life, I'm either treating patients who've never met me before, and when they meet me, it's probably the worst day in their life, or I'm treating patients who have an asymptomatic disease that could cause a problem down the road. And so at best, I'm either doing salvage operations or I'm trying to prevent something in the future. And patients are very grateful, but at the end, nobody's going to wake up and thank their neurosurgeon for saying, hey, I love that brain surgery, sign me up for another one, even though they know it's the right thing. Trigeminal neuralgia is one of the few disease processes as a vascular neurosurgeon you can treat where your patients wake up completely different. They come to your office and they're in excruciating pain. Their life is miserable. And in a select number of patients, what you do changes their entire life. And they wake up and they're grateful. It's night and day to see someone who has had successful surgery. They can eat, they can talk, they can get on with their life, they can smile, they can take shower, they can brush their teeth. And so there's few things one can do in my subspecialty that are so gratifying as a physician to provide that treatment. What I do wish is, with Pat's help, if we can find better ways to expand our scope of treatments to a larger number of patients.
And Pat, you said this is the only
group. I mean, there's people doing research, right? Yeah. There are different researchers at different institutions, domestically and internationally. And those are instances where if somebody has research that's far along, we'll try and chip in to kind of move that further along. But in terms of any groups, right? How many groups are there funding cancer research? There are probably dozens, right? But we're the only group that's dedicated to that. We're our goal is to provide seed money for new research to move along existing research, but I think also to get other people to do research. I think that's the thing too. I think if that's probably the greatest benefit that we could have is to get other people to do research too.
Correct.
Right?
There has to be better ways, and there are upcoming research studies Pat and I have spoken about that we can't at this point mention on this show that are coming up.
I got classified information,
tell
baby.
us after.
I don't have that much, actually. He gave me about this much.
Is it hopeful, though? Is it something that...
Sure as hell hope so.
Definitely hope on the horizon, but one has to understand this is a rare disease.
Right. Yeah. There's no silver bullet.
Correct.
Yeah.
There's multifactorial aspects of it, and because it's rare and it's not well recognized, it doesn't get the publicity that it should. So that means that the public funding for research in trigeminal neuralgia is very low. Right? We always talk about moonshots for cancer care and cardiac care, and those are absolutely important disease processes. But trigeminal neuralgia is kind of like the neglected stepchild. It's horrific, it afflicts enough people, but the funding process isn't there. And this is where fundraising, as Pat is doing, really comes to fore. So this is where I get to say this.
Yeah.
Whoever's watching, I want
Yeah,
you to
do
go
it.
to laughyourfaceoff.org.
Learning how to give plugs. I
There
love
you
it.
go.
You've been coached well.
And there's the spelling is straightforward. Laughyyourfaceoff.org and bid on that silent auction.
I didn't know
We
if I
need
was
your
going to
help.
make it, so I was coaching him yesterday. I'm like, plug that goddamn auction.
And we'll put the link and everything in that.
Yeah.
Are we
description,
allowed
yeah.
to do a high five in public?
Sure, why not? That wasn't uncomfortable at all. Look at how cool we are. Yes, look at us amongst all the Gen Zers and millennials.
I see a lot of eye rolls already happening up there.
No. Hey, let's take another quick break here because I want to talk to you guys about a new cake that Portillo's launched. It's our first new cake in 20 years. It's called the Salted Caramel Spice Cake. It has 2 layers of moist spice cake paired with a creamy salted caramel frosting that combines sweetness and fall spices to bring out the best in both flavors. And you could also get it in a salted caramel cake shake.
I mean, I guess I missed that on the other ad copies. I didn't know it was the first new cake in 20 years.
20 years.
I mean, you know that this is 20 years of blood,
Tinkering
sweat, and
and-
tears to launch it. I was in high school the last time they came out with a new cake, so I can't wait to try this one.
It's good stuff. They blended both flavors well with the spices and the salted caramel. So check it out. They're doing Spice Timber. During the month of September, get a $1 slice of salted caramel spice cake with the purchase of an entree. Offer available for dine-in and drive-thru only. It's available for a limited time, only this fall. Stop in and try a slice, whole cake or a cake shake today. Order at Portillos.com or head to your local Portillos to satisfy your Chicago-style cravings today. And like I said earlier in the show, we're going to be in Indianapolis with Portillos, handing out beefs.
We
gift
got
cards.
merch to give out, gift cards, so come find us. I mean, I love that stadium, and it's so easy with all the parking. So I'm not sure which lot we're in, but you'll be able to walk there easily. So come find us.
Yes.
Even if you're a Colts fan.
Yes. Come on by.
What is there a demographic that this impacts?
So
More
it's
than other-
much more common in women. It's about,
Okay.
1 to 2. So 2/3 women, 1/3 men. And it's certainly more prevalent in women in their sort of late 40s and early 50s. So that's a very common portrait of a typical patient.
And is it more prevalent in the United States than other places?
Unclear. The
Unclear,
difficulty is
okay.
that also the United States has a more, I think, educated healthcare workforce to recognize that. So you get into a lot of those nuances. There isn't a good geographic variation, but there certainly is a gender and age bias towards it.
And you just wake up and it's like that. That's terrifying.
I would say more often than not, right? Some people have injuries to the nerve or some kind of catastrophic injury that causes it, but more often than not, it just happens.
Yeah. Is there if we move along to other parts of your practice? So you said what was the other things? Aneurysms and carotid is a big part of it too, right?
So imagine a vascular neurosurgeon is basically a brain plumber. That's
Okay.
honestly the best description of it.
Okay.
So any blood vessel that supplies the brain, a vascular neurosurgeon will treat the disorders that relate to that. So the blood vessels all start, from the heart, which is basically the pump. Plumbing analogy. So we don't do the pump. That's for our cardiology colleagues.
Yep, we had one of those in here.
There you go.
Yeah.
Then the pipes go up through the neck, through the bone at the base of the skull, and then you can kind of see how they, at the base of the brain, divide to then supply the surface and the innards of the brain. And so at any point, if there's a blockage or a leakage or a malfunction in one of these blood vessels, and I'm not mentioning the spine that also has blood vessels, that's where you call a brain plumber. And by and large, there's 2 broad ways of treating disorders of the pipes. Think of the pipes as either leaking or blocked. And the 2 ways to approach it is, imagine you've got a pipe, behind that drywall. You can either open the drywall, open the pipe, replace it, or clean it out and put the drywall back. So we call that open surgical procedures, where you make an appropriate incision on the appropriate part of the brain, work under the brain or through the crevices of the brain, never cutting the brain itself. So you can do these without injuring the brain. So that's the open surgical procedures we offer. Or a plumber can use a roto-rooter, snake it down a plugged pipe and pull out blockages. So if somebody comes in with an acute stroke, they've got a blood vessel blocked in the neck or in the brain, and they're having the signs and symptoms of a stroke, we rush them to what is called a angio suite. This is where under X-ray control, we can see all the blood vessels, and through small little punctures in the wrist artery, groin artery, snake up all our devices inside the brain and pull out that clot and open the blood vessel, or if there's a leaking blood vessel, patch it with various devices.
Can you tell them I found this fascinating when you told me how you practice the night before a a surgery on chicken.
Yes.
Right?
So there is a particular procedure that we do called bypass surgery. This is where a blood vessel in the brain is irrevocably blocked, so we can't open it from the inside. And so the only way to provide the brain a new source of blood supply is to route another blood vessel to it. And one can either take, let's say, a radial artery graft. So you've got an artery here that you can harvest it. Very similar to how our cardiac surgeons will do bypass for the heart and sew it to an artery in the neck and then tunnel it and then sew it to an artery inside the brain. Or there's scalp arteries that you can use. And so you can sew a scalp artery that's on the outside of the skull, make a small hole in the skull, and then bring it and attach it to the brain. Now, to sew that, you're using what we call 10-0 stitches. These are some of the smallest stitches, almost the size of a human hair, that you can barely see with a human eye. So we do these under high magnification. And despite having done many years of it, there's nothing like just rehearsing the procedure one mentally the night before, and also just getting your hands wet again. And so the chicken wings have about the right size artery, and I teach my residents all of this, and I put my money where my mouth is. I also make a point of always rehearsing. So the night before, you just buy a bunch of chicken wings. We've got a great lab. And
Isn't Joel buying chicken practicing for surgery?
Not a joke. Not a joke. And you sew a couple of chicken wing arteries to each other, and that just gets you smooth and ready for the next day.
Wow.
So if someone sizes you up at Jewel and they see you in the chicken department, they're like, he's not going to
This
eat
guy's
those.
buying 3 bags. Joe, look at this guy.
He's got some big ones
If I'm
coming
buying
up.
chicken wings, you know there's a bypass tomorrow.
Oh, man.
Gosh.
That's unbelievable.
Wow.
I can't believe you remember that. I'm so impressed.
How would I forget
That's
that?
a great
You
story.
don't forget that.
Yeah. Is any of these procedures done with some of these stitches that are a human hair in width? Do they have any like robotics or anything that help you with this, or?
Coming out. So the
Okay.
difficulty it's such a fine scale that the
Right.
larger robots that are designed to work in the abdominal cavity or the chest cavity have not been adapted. However, over the past year, there's a couple of manufacturers that are bringing out experimental models of these robotics. And I have great hope. I mean, never bet against technology. In 5 or 10 years, there'll absolutely be robots where you can sit down comfortably with appropriate, 3D goggles, sit your wrists, eliminate any micromotion or tremor. The robot may be able to augment or smoothen your motions and do an even better job. So I do believe the future will be, but right now, the technology is just not there. The size of the vessels is too small. The brain is too delicate. So at this point, you really need expertise in the surgeon who's treating you.
Now, other than the chicken, how do you prepare for brain surgery? Because I feel like everyone's had, like, you go up on stage, we've done big games, things like that. It can't be anywhere near that. So is there a routine that you do to get yourself like in a, almost, I feel like you have to be in a Zen state to do that?
One of the key things is just having enough reps. So as you have more experience and you become more subspecialized, you do more and more of the same thing. And there's no substitute for, seat time in the cockpit. Having said that, there's also no substitute for preparation. So always the night before, I spend 2 to 3 hours going over every single picture. Our imaging system allows us to 3D model any of the blood vessels, and I mentally rehearse every step of it in terms of how I'm going to position the patient, what are the optimal positions for the incision, the place where we would cut the hole in the skull called the craniotomy, the angle of where I want to approach, mentally rehearse what are the things that could go wrong, what are my backup strategies if plan A fails, what is plan B, C, and D, so that the day of the surgery, you've already played this multiple times in your head. You almost can close your eyes and visualize everything. And that's still not enough. There's always surprises, and the years of training and the years of experience prepare you to always have a plan A, B, C, D.
When I hear him talk like this, I'm like, how is Dak Prescott making more than him? Right? He should be
No,
making
for
more
real.
money than anybody in the world.
Yeah, it's
The
crazy.
sad
It's
thing is,
insanity.
we would do this if they paid us nothing.
Yeah.
I'll just
Yeah.
be honest. Like
Yeah.
there's nothing better to do in life than to do something that is more than your own immediate self, right? Imagine being able to have an impact on someone of that magnitude. What I teach our residents is there's no more important, no more noble organ than the brain. And then I'll teach my cardiology colleagues at the end of the day, you could pick up the heart, drop kick it across, the room, pick it up, wash it, clean it up, and it'll still beat.
Yeah.
And if you can't find a transplantable heart, we have amazing mechanical devices, right? You can transplant almost anything, and at some point we'll be able to do that. But
you think so? You'll be able to transplant a brain?
Except the brain.
Oh, okay.
So that's the key.
I was like,
Right?
whoa.
Who you are, whether you think of it as a soul or a computer, like your entire existence is this thing in your skull. Like everything else is basically a support system for the brain, and it sends messages, and all of this is robotic motions. But your thought process, your consciousness, who you love, your memories of your parents, your wife, your loved ones, it's all right there. So the privilege to be allowed to operate on the human brain is rare. It's not given to everyone, and it's something that probably doesn't draw everyone to it. But it's amazing to be able to work with your team and bring that to patients, and the high you get, the sense of accomplishment you get by getting someone through that and bringing new life to them. There's nothing that can replace that.
I can't even imagine. Is it something that from like time you were 8 years old, you always knew you wanted to do, or?
Probably late teens to 20s. My father was a neuroscientist, and so he always sort of inspired me with doing something with the nervous system. So I did a lot of basic research when I was in medical school in early undergrad. But once you walk into an operating room, you see the live human brain pulsing in front of you. And you see someone operating on it, it is absolutely addictive. There's nothing that can replace that. And so for folks who apply to that residency and want to do it, you can completely understand why these folks will put 80 to 100 hours a week of training, and the same keeps up when you are a faculty attending. It is an amazing thing to be able to offer.
I have a lot of questions about the brain. I'm fascinated by the brain. I know nothing. It makes no sense to me. So when you're looking at it, and you have the skull detached, and let's say someone is obviously under anesthesia, and it's pumping. What is going on in their head? Like I always have these questions, like where does a thought even come from? Like how does it work? Do we know anything on that level? Like where a thought comes from, the actual functionality of it?
We are getting there. So, throughout history, folks initially would use patients who had selective injury to parts of the brain to try to map out, all right, if that part is injured, then here's the function that's missing. So that part is responsible for that function. Somewhat crude. And then as anatomy and physiology expanded, we were able to model things on animal models and learn from experiments to determine if parts of the brain are stimulated, this relates to this part of the function, and we map that to the human brain. Now, at this point, we have sophisticated technologies where we can actually open the skull in a patient who's awake and electrically stimulate parts of the brain and directly map out this part of your brain is responsible for this exact function. Here's a safe avenue where we can work towards, let's say, a complex brain tumor and maximize resection and not harm you. And the patient can be, talking, counting numbers, playing an instrument, and we can really devolve what are safe avenues of what are not to explore, but also with imaging, with MRI, you can now map out in 3 dimensions what parts of the brain are responsible for speech, for motor function, for moving your finger, your toe, and so on and so on. And we just scratched the surface of it. Imagine how fast our technological advances in AI, in computation of massive data sets and imaging are going to go. 10, 20 years, we'll have an even better idea of how what is probably the most sophisticated biological computer really works. And we've made a lot of strides, but there's a lot more to do.
If you had like a one chance to say, tell me this about the brain, and you could answer that question that you want to know, like what's your burning question that you'd like to know?
I'd love to know what kind of ensemble of neurons makes us self-aware.
That's what is consciousness?
Right.
What is it?
This
and
is
where
taking
is
a
it?
turn. This is taking a turn, Ed.
Yeah.
I think Ed and I are sitting the rest of this
We
conversation
moved
out.
on to macrodosing? Yeah.
Because truly, it's there, and we have.
I think he
It
wants to
has
know,
to be
is this
there.
a simulation, is what he's asking
Well,
you.
do you think of it as a computer? Because
in some ways, I do. If we make the computer analogy, the brain at the end of the day is a vastly interconnected network of what are teeny little processing units called neurons, right? So technically, in some future, if we have the understanding and the computing power, it's not unreasonable to think that we might one day be able to simulate the connections and the organization and how a brain works. That is potentially controversial opinion. And it may be that consciousness emerges from the collective ensemble of all these neurons firing together and creating that entity. But are we close to understanding it? Not yet. Will we one day get close to it? I'd like to think so, but...
Is there a lot of research going into finding that question?
Oh, immense amounts.
Yeah.
There is a vast amount of work looking at brain imaging, trying to map out how thought processes work, what the interconnections are, what is the resting state of the brain, the excited side of the brain, and then how do we feed these data sets into then neuronal models? How can we model neural networks? And there becomes the interface between the huge AI research, and one day maybe becoming more than generative AI, but general AI, and then the intersection of the biologists looking at how does the human brain function from the small neuronal units to the ensemble connected rhythms of the brain. So have no doubt, you never bet against technology and human progress. 10, 20, 30, 40, 50 years, we'll have a vastly better understanding of the human brain. What we will not be able to do is replace it. So the human brain is made of cells that don't divide.
Huh, I didn't know
right?
that.
So
once you kill a brain cell, it's gone.
Correct. The brain has to reprogram itself. And so you're born with all the brain cells you're going to get. And so as time passes, the natural progress of human life is that our cells will eventually deteriorate. The brain doesn't have a good way of replacing itself.
Okay.
Now, could one day stem cell therapy help it regenerate? Maybe. But for now, the message for our audience is make the best use of your brain, protect it, treat it well.
Don't poison it with
Correct.
certain things.
you won't get extra chances. There's not an extra brain out there, and it doesn't regrow. So treat it gently.
So when you have on that notion, when you have a baby's brain, it's obviously much smaller. So if our brains aren't are they actual just cells growing?
So baby's brain isn't necessarily that small. It does grow a bit, but it has all the neurons ready to function. What happens over time is the myelin coating that we talked about, the electrical wiring becomes more developed and the interconnections become developed. So you're born with the computing power, but the wiring has to develop, the interconnections has to develop. And as time passes, you see more, you experience more, you learn more. So your growth curve in life is all these neurons forming new connections.
Okay.
And changing the network properties, your memories of your childhood or how to operate this microphone or how to pitch to a larger audience is all changes in neural connectivity.
And are there ways or things you could do to improve that even as an adult? Like, let's say, like, I don't particularly feel like I have a great memory. Eddie's got an amazing memory. I don't. Are there things that I could do to improve my own brain health at 38 years old?
Two aspects of it. One, practice makes perfect. So the more you think, the more you practice, the more you rehearse, the more you're fine-tuning those connections so that they make stronger connections.
Yeah.
And so that's how an athlete will learn more. It's not just the body fine-tuning it, it's the brain learning the right move and figuring it out better and better the next time. So certainly, any thinking skills, any exercises, like use it or lose it for the brain.
Okay.
So that's one aspect of it. The other aspect is just general health, right? Anything that affects your body is affecting the support system for the brain. So think of eating well, exercising, maintaining good cardiovascular health, avoiding any possible toxins to your body because eventually they may cross the blood-brain barrier and affect your neuronal cells. Treat yourself well and treat your brain well. And then for our cyclists out there, please wear a helmet. There is no substitute for that. There is probably a terrible joke that I'll make just in this audience, and one of the unfortunate but perhaps cruel but yet appropriate comments people make is if you see a cyclist without a helmet, they're called organ donors because that's what happens.
Yeah.
And so for the audience out there, please don't let us see you in the trauma room without a helmet, because at that point the ship will have often sailed, and it's worse than salvage therapy. You don't want us to be telling your loved ones there's nothing we can do because you didn't wear a helmet. So I'll put that pitch out there.
Okay.
How often is it where you're in immediate trauma surgeries versus like, I got to plan surgery tomorrow?
It depends really at what stage of a career you are
Okay.
and what you're subspecializing. As a vascular surgeon, I don't see that much trauma. I see a lot more of acute stroke, ruptured brain aneurysms, or bleeding in the brain, and less of those caused by trauma. Whereas there's other neurosurgeons and my other colleagues who will focus more perhaps on traumatic brain injury. But all of us are trained in a JAM. We can do all of the general work for a TBI, a traumatic brain injury patient.
Go ahead.
Now, this might be a dumb question, but obviously strokes, they say you got to get to them really fast,
As
right?
fast as possible.
So do they not do surgery right away then, or they're doing something that, and then it's like, all right, you'll see Dr. Jahromi tomorrow?
So it depends. If you're having an acute stroke, let's say a large blood vessel is blocked in the brain, your brain cells are dying at a rate of 2 million brain cells per minute. And so every single minute counts. And that's where the patient has to call 911 as fast as possible. Time is brain. Another pitch I'll make is think of the acronym FAST for face, arm, speech, and time. So if your face is drooping, if your arm is falling down, if your speech is muddled, think of T for time. Just call 911. Get to the hospital as fast as possible. In every emergency department, there are protocols set up that if somebody presents with the signs and symptoms of stroke, you are rushed to the CT scan machine where a quick picture is made of the brain, that's the tank, and then the blood vessels, those are the pipes. And so you want to know, is there an issue with bleeding in the brain? Is it a leaking stroke, or is there a plugged blood vessel? Is it an ischemic stroke? And if there is an ischemic stroke and it's the appropriate location, the appropriate imaging criteria, then the patient is rushed to the angio suite. This is where under X-ray control, we can snake up the medical equivalent of a rotor-rooter under X-ray control, but not just much, much smaller, into the smallest blood vessels of the brain, grab that blocked blood vessel, whatever's blocking it, and pull it out and restore blood flow. So those are absolute emergencies. Wow. There are other patients who've had a very minor stroke. They may not have noticed it, or the stroke symptoms have passed, so it's a transient ischemic attack. And in those cases, we're looking to see if there's a plaque or a narrowing of blood vessel that could predispose you to another stroke in the future. And those cases are not as emergent, but they're treated on an urgent basis.
Mm-hmm. What's worse, a block or a leak?
It really depends.
Yeah.
You could have a minor block and get away with it. You could have a major block that is life-threatening or potentially fatal. You could have a minor leak. Let's say a brain aneurysm has leaked just a little bit to give you that classic catastrophic worst headache of your life, enough to sort of remind you, my God, something horrific has happened. I've got to call 911. Or it could be a larger leak that puts you into a coma, or an even larger leak that unfortunately is fatal.
You mentioned something earlier, the blood-brain barrier. I don't really know what that is. I've heard people talk about it. What is that blood-brain barrier, and if you just talk about the importance of it and how strong it is.
So the brain is a very privileged organ. Everything in the body is really designed to support and provide nutrition for the brain, and that's why the brain sits in a pretty thick skull, right? The rest of the organs don't have that kind of protection. And similarly, the brain is very picky about what chemicals it wants to see. So the brain sits in a warm bath of cerebrospinal fluid. That supports it. It has the nutrients it needs. The blood vessels that supply the brain have a different type of endothelial coating than the rest of the body. And in particular, they have very tight junctions. So not every substance in the blood can cross that endothelial lining, which coats the blood vessels, to exit the blood vessel and get to the brain cells. And so that endothelial lining is called the blood-brain barrier, and it's very selective. That is a protective thing for the brain. Mm-hmm. However, it's also a challenge in that getting molecules to cross it that are therapeutic is not straightforward. So one example would be in certain brain cancers, it's not straightforward to get chemotherapy drugs to cross the blood-brain barrier to go into the brain. And so in some instances, we have to think of ways of temporarily disrupting the blood-brain barrier so that for the time being, while we're giving those agents can cross through the blood vessels, get to the brain cells, and have that effect. One interesting way is you can use ultrasound methods. So you can transiently use ultrasound methods to disrupt the blood-brain barrier. And one of my colleagues, Adam Sonnabend, has done amazing research at Northwestern, where he implants a ultrasound device just within the skull underneath the scalp. It's a permanent implant right where the tumor is. And then secondarily, he can use that to temporarily open up the blood-brain barrier and get chemotherapeutic agents or other novel agents to now better treat brain cancer.
I mean, now that I'm just on this thing where it's like the brain is inventing ways to heal itself, like through other people. like that is where it breaks my own brain. It's like, how do you think of something that never existed and it's healing itself and it named itself?
It is the most complex, most fascinating, most challenging organ in the body. And I say that with all due respect to all my colleagues, but this is one of the reasons folks like neurologists and neurosurgeons are drawn to this, what used to be a black box, but less and less of a black box and more of an ability to heal and treat with, again, some exceptions. And so I'm going to again go back to trigeminal neuralgia. While we have great ways of thinking and treating it, I do want to remind the audience, go to laughyourfaceoff.org.
Yeah.
We'll start going down the prizes too while you're at it.
Well, that's your job.
Yeah.
I'm going through the silent auction items. They're incredible.
Right?
Some great ones.
So we have a tour here with Big Cat.
Yeah.
Yes.
But there's...
Which, by the way, should be triple in price. So get your people bidding on that. That is way too low right now. Dude, I would spend that. What that bid is at right now, I would spend that
What's
to
that
stay
right
here
now?
alone by myself for the night. I think it's a little over $5,000.
Yeah, it was a little over 5K.
little over
but
$5,000.
they're gonna take a cruise with Chris Chelios.
Oh,
There's a pizza tour.
Can
There's
I
a
tell
mountain.
you?
Yeah.
That would be a good Barstool
Get
team
Dave.
outing.
Yeah.
Oh,
You
to
get
go
Dave
with
to
Chelios?
book it for the 11 highest producing employees in Barstool, Chicago. I'm just saying, I think that on a yacht, on an 82-footer,
Yeah, we've been trying to pin down Cheli
Chelios?
too, so that would be good.
That would be great. Gonna get a week in Hawaii. There's lots of great prizes.
Yeah,
on
it's
here.
unreal.
Yeah.
And that's all on laughyourfaceoff.org.
Yeah, you go to laughyourfaceoff.org. Anybody can bid. You don't have to be present to win. Anybody anywhere in the country can bid. We'll ship the prizes to you. It's all digital. So many of the experience packages. I mean, there's like a lot of stuff like restaurants and hotels and stuff that are here. But I can't even believe some of the restaurants that donated to us too. Like
Michelin star restaurants.
Ever, yeah.
Our good friend Joe Flam.
Oh, God,
Chef's table for 6 at Rosemary. Maybe that's a team dinner.
Yeah.
Yo, no, don't touch that one. Okay. somebody here might be leading in that one.
Okay. All right. We'll leave it
I
alone.
may have to beat that, just warning you.
All right, listen. I know the owner. I'm going to be fine either way. But if
Yes.
you would have bid on it,
Yeah.
Yeah, that place is awesome.
Yeah.
No, there's some great things on there, so people should go check it out.
yeah.
And,
All the money, it's all tax write-offs. Everything goes to our research. Even like that Hawaii thing, like I think that's going for $3,300 right now, and it's sleep 6. That's 3 couples.
is
That's
a
$1,100
discount.
ahead for
I
a
know.
week in
That's
Hawaii.
That's an unbelievable deal.
yeah,
Yeah.
that is. And when does it close?
Saturday night at 9 o'clock, 9 p.m. Central.
Okay.
Yeah.
So 9 p.m. Central. You got until then. So you got today, tomorrow, and you got Saturday.
Yeah. Meet Sebastian Maniscalco. Okay.
That was pretty good.
Huh?
That was pretty good.
Yeah.
It's a great impression.
Huh? It's
Yeah.
all right. It's all right. It's average at best.
All right, then. Dr. Jahromi, we have like a million
He's
more
the
questions
best.
for you, but we could wrap this up. Thank you so much. Pat, thank you.
Thank you,
this
guys.
was
No,
great.
really appreciate it.
It's been an awesome pleasure. Thank you for having us.
Is there anything you want to get out there, Dr. Jahromi? I know you got some social following over there. I saw that.
Yeah, I
Yeah,
noticed
he
that
is
too.
a good
He's got some
follow.
clout.
Yeah, he does.
If folks are interested in social media, Northwestern has some great channels on both their Instagram, their Facebook. But if you're absolutely bored and you want to follow a neurosurgeon on their social media, feel free to look me up.
But
There's
you also post stuff from procedures, right?
amongst the gratuitous selfies that are required as part of the job now. But you can certainly see pictures of patients with their permission. You can see trigeminal neuralgia pictures. You can see patients who've had that procedure. You can, in fact, see the trigeminal nerve and an artery beating on it as one of the pinned posts.
Yeah, that's real cool.
So if you want to see that disease process and you feel like following a middle-aged neurosurgeon on Instagram, have at it.
All right.
And what is the handle?
It's Babak S. Jahromi.
All
So BABAKS JAHROMI. And I can't believe you made me plug this on.
No. Come on. I'm telling you, people are going to be like, I need more of this.
Yeah, I know.
Go for it.
Yes.
I will warn you, the Instagram stories are usually just Chicago architecture, which I love taking pictures
Yeah, it's
of.
pretty good too.
Yeah, that's cool. That's fine. Pat, you work so hard on this, man. Great cause. And,
Great. Looks like a great event.
Yes.
It is. I would go out on a limb and say that it's definitely the biggest comedy fundraiser in Chicago, and I would say it's definitely among the best. Period. It's a special event. It's a really unique and wait till you see what I got in store for you this year.
I'll be more blunt. It's the biggest TN fundraiser for a disease that's otherwise ignored. Pat and Amy put their heart and soul into it.
Mm-hmm.
Most patients who have this hide away, and they don't want to talk about it. And I cannot believe how willing you guys have been to put yourself out there for something that is really painful personally and in some aspects professionally. And you know, Amy comes to the show and she's wincing in pain and she smiles and she goes through it. And again, kudos to Pat and Amy. They've inspired the rest of us to work harder, to do better, and to try to find better ways of treating this. So honestly, a huge fist bump.
Yep.
Thank you to you.
Thank you.
Yeah, just the email you sent me was
Yeah.
pretty powerful, man. So good on you.
Yeah, man. It's one of those things where it's all you can really do, right? It's like the only thing that gives you any sort of modicum of control over the shit show that she's living in every single day, right? So, you know, obviously the research is what we're hoping to advance, but it's also, I think it's hope. I think it gives a lot of patients hope more than anything else.
There is and will be better treatments out there. I have no doubt.
Awesome. One more time, laughterfaceoff.org. Thank you, Dr. Jahromi. Thanks,
Yeah,
Pat.
link will be in the
thanks,
description and everything too.
Yeah, if
so
you guys want to check it out.
Yep.
So that's it. Thanks, everybody, for listening. Thank you for watching. That's it for this week. We'll see you guys on Monday.